Yeah, so everyone, I want to welcome you to the MIDAS COVID-19 webinar series. I'm Jing Liu, and I'm a MIDAS Managing Director. We have been running this weekly series since April and featured many U of M data scientists and their projects on COVID-19. We were just talking that Danny's is the 10th in the series. So I'd like to invite you to go to our website and watch the videos of previous talks as well. You'll see how our researchers use data science to study this pandemic from many perspectives, from diagnosis and treatment, how the disease spreads, to how to deploy medical resources, and how to help our community cope with the consequences. Today's speaker, Danny Forger, is a professor in the Department of Mathematics and in computational medicine and bioinformatics. His main research area is mathematical biology, especially understanding biological clocks with computer simulation, mathematical modeling, and analysis, such as dynamical systems, numerical methods, and machine learning. In addition, he also carries out data science research to understand the structure of music composition. Today, his talk is a mobile wearable platform for collecting data on sleep and circadian rhythms in the time of COVID. This is a natural extension of the research that he has been doing on mobile health and biological rhythms. Before I hand this over to Danny, I also want to remind everyone that please feel free to put down your questions anytime in the Q&A box or the chat box. All right, so Danny, I'll let you share your screen and take over from here.
Great, thank you very much. Can you hear me?
Yes.
Okay, great. As I said, feel free to ask questions, and raise your hand or other things. I may not be able to see it, but James or Jing could just interrupt, and very happy to chat about it. So what I want to talk to you today is about the social distancing and the lockdowns and using large-scale mobile data to see how that's affecting our internal biological clocks. I'm going to talk not just about the research aspect of it, but also apps that we'll be deploying potentially that could be used by students in the fall to help them adjust to the new semester and so forth. Here's my general information. I should mention that today I'm moving. I've been on sabbatical at Harvard's NSF Simons Institute, but I'm heading back today. My general advice is don't do a sabbatical somewhere during a pandemic, and also don't give a talk on the day you're moving. But anyway, here we are. If you're interested in biological clocks and rhythms, I do have a book from MIT Press that's available online for free. So some of the details you'll get from that. And it's important for me to thank the people who really did the work. This is a collaboration between many different people. And I'll highlight some of their work going on. But let me especially highlight Chris Stockbridge, who works at the LSA Technology Service, LSATS, formerly LSAIT, and he's really helped us build the framework for collecting a lot of this wearable data. But there are also many collaborators and so forth. I'm also part of a company that's using wearables and Circadian, mainly because of an SBIR to think about cancer. When many of you think about COVID and everything going on, you're probably not thinking about biological clocks. These are the internal timekeeping mechanisms that we have that tell our bodies when to wake up and when to go to sleep, when to be most active. And these biological clocks regulate basically every physiological system in the body, have been related to many different diseases. The key thing about biological clocks is they need to be reset every day. The period of circadian clocks is not 24 hours. It's, for most people, slightly longer than that. So if you don't get the right signals to your biological clock, you could start free running or not adjusting properly to the circadian day. And we see this often in some college students who keep very erratic schedules, even before the time of COVID. But when we thought about it some, when we first began and the COVID crisis hit, my collaborators and I were like, oh yeah, everyone's going to start working on COVID stuff and we never will work on COVID stuff. But we quickly realized that the COVID crisis created the world's largest circadian rhythms disruption that we've ever seen. Because all of a sudden, all the signals that our bodies are getting telling us what time of day it is have been changed drastically. The main signal we get is light, particularly outdoor light, and especially during lockdowns, people are mainly indoors. And as you know, many countries, 4 billion people went through the lockdowns, and many of them were very restricted as to how often they could go outside. So now all of a sudden we replace that outdoor natural light that's known to regulate our circadian rhythms, and we replace that with indoor lights which we could control. Another thing is that our circadian clocks are very much affected by the people we live with. And there's animal data on this and human data. And who we cohabitate with, who we socialize with, has also drastically changed in this COVID, crisis. And in my particular case, perhaps as well as some of you, we now have children who are living 24/7 in the home and don't have the strict regular routine we used to have of kids getting up, walking them to school, and so forth. So all those factors that also synchronize our circadian rhythms change our, have changed. An additional thing is probably the #1 culprit for messed up biological clocks is screen time. All the external light that we get. We wake up in the middle of the night, we can't fall asleep, so we turn on our phones and start checking our email and all this. And it's all that light, especially blue light, that sends very conflicting signals to our circadian clock, such that the next night and the night after and the night after that, we continue to have difficulty sleeping. And likewise, most of our work schedules have changed, and a lot of shift work and travel has changed a lot. So the COVID crisis, and let me emphasize this, could actually be beneficial for certain circadian rhythms. For instance, individuals who are shift working and now aren't shift working, or individuals who do a lot of trans-meridian travel and now all of a sudden are not doing that. So their circadian rhythms might actually be more regular. But what we do know is that the COVID crisis has changed circadian rhythms drastically. People have typically focused on sleep, and there have been a number of recent papers thinking about sleep itself. There are two things that regulate sleep. One is this biological clock, which tells the body when to go to sleep. The other is the homeostat, which is basically a measure of how tired one is. So realize that when we think about effects on sleep, we may very well be thinking about the effect of circadian rhythms. That being said, we actually don't have a clue as to how, even though we're having the most dramatic change in our global change in circadian rhythms, we actually don't know what it's doing. And it's certainly going to affect college students very differently than elderly people, very differently than shift workers, very differently than children. Let me also finally mention that circadian rhythms are really important for fatigue. They're also important for mood, but the circadian clock regulates the immune system. So one wants to have robust and trained circadian rhythms for optimal health. And again, one of the key questions is why are some people in terms of when they're exposed to COVID, become asymptomatic or don't even get the infection, whereas others are very susceptible to this. And there's a lot more research that has to be done, but one of the key questions is just the immune function. And what we do know is that the circadian clock shuts down a lot of the immune function at night. And this is also why people who stay up very late or people who take an overnight flight to Europe, not only are you exposing yourself to a lot of germs, you're also doing it at a time where your immune system is kind of taking a nap, and all of a sudden you're much more prone to infection. So there has been some publicity about all this. For instance, here's a piece by Sachin Panda at the Salk, who again argues that if one wants to enact measures to prevent COVID. I mean, there are certain obvious things which even I would have to admit are much more important, like wearing masks, washing hands, and so forth. But if you really want a comprehensive strategy, making sure your circadian clock is properly entrained is also an important part of this. So how are people changing their sleep schedules during COVID? There have been a couple of studies, but I was actually most interested in a little bit of data that was released by Fitbit. Fitbit started to look at how people were sleeping differently. One of the questions they asked was because sleep was changing in different individuals, how is this being affected by the COVID crisis? So the hypothesis that most people thought about was that obviously people in the heart of the COVID crisis were getting more sleep because their work schedules were being changed a lot, and that drastic pressure to be in the office till 2 a.m. or doing problem sets in groups till 2 a.m. kind of disappeared. Now, based on research we've done with mobile technology, middle-aged workers are the most sleep deprived. So if this really were the correct hypothesis, we should imagine that they would get the most increase in sleep time. Another thing is it's possible that the changes we're seeing in terms of sleep during the time of COVID, are actually due to the circadian clocks becoming less desynchronized. What we would then see is that in the beginning of this crisis, which this data shows, younger adults would start to sleep in and go to bed a lot later, and there would be a lot more sleep irregularity. The sleep quality would decrease, and the greatest effects would be at the highest latitudes because it has less daylight, and they would be getting less of the natural light signals. And just to show you a tidbit of data just before COVID, here's typical times when individuals at different age groups go to bed and wake up, broken up for men and for women. And as you could see, once we release, adults into the wild, into college and the workforce, all of a sudden they start to go to bed a lot later and wake up a lot later, but then they slowly wake up earlier and so forth. So here are two hypotheses we had, and here is the change in sleep that occurred in the beginning part of this COVID crisis during the big lockdowns as reported by Fitbits. Again, you could see that in general, people were actually getting a little more sleep, but this wasn't universal. This hypothesis that they're all getting more sleep because there's less work schedules, well, in that case, what you would imagine is that the people who are benefiting are these middle-aged workers, and the curve does not look peaked around there. In particular, it slowly declines, sort of like the slow decline here, perhaps due to circadian synchronization. And again, what one sees is that the less circadian synchronization one gets, which is allowing people to sleep more, occurs in more northern states like Pennsylvania and New York, and less so in southern states and Florida. And this data was from March and April. So with this gave us a tiny bit of data, but we wanted to collect a whole lot more data on this topic. And after a lot of discussion, we very quickly realized that we could create an app, which we're going to call the Social Rhythms app, that could actually collect a tremendous amount of data in the time of COVID. In fact, we had been working with Chris Stockbridge on this app earlier to study how various life events like having a child or other things affects biological timekeeping. But here what we decided to do was repurpose the app and release it as a COVID app. And so what we decided to do was this app, and it's an iPhone app, we're hopefully going to have an Android app pretty soon. It would ask individuals basic demographic questions and when one begins social distancing. I'll show you a little more detail those questions. And then what we did was we set up an IT infrastructure which allows individuals at one time to submit a lot of historical data to our servers. And we were able to build this in such that we could get Apple Watch, Mi Band, and also Fitbit data and process them and put them all in the same format in our servers. Another thing we decided to do about this platform was to keep all the data being sent anonymous, and also all the information we send to individuals anonymous. And this took a fair bit of thought. Just the step data or heart rate data is in and of itself is not identifiable. But again, if we had a web address or an email or particular ways to contact people, that could be. So the idea is that the phone generates a random number, just to make sure it's not the same person spamming us all the time. And then they send us all this information, we crunch it on our servers, and then send them back a report. And this report would tell us, the first version of the report says how their circadian rhythm has been affected by the COVID crisis. Additional reports could talk about sleep or other things, and I'll give you some ideas about it. And a final important detail was we wanted also to make it such that individuals can remove their data at any time from our servers through the app. So again, I'm very grateful for Chris Stockbridge. For about a year before this, we'd been thinking about how to do it, and then all of a sudden, COVID came, and we realized that this would be very useful. And we were actually ready to release this app in April. I should say that Apple took 2 months to review the app, which was unusually long, and I'm not quite sure why. We heard nothing for so long, but the app is now available. A bit of the infrastructure in the background. So again, we had this iPhone app running, which interacts with a web server. And this web server also will will interlink with this database, and this database contains users' information, but there's a lot of pre-existing data we have from other studies. For instance, Fitbit data from Srijan Sen's medical intern study, other potential studies. So the idea is to augment that data with new data that's collected from this iPhone, and then queries can be made, from the iPhone app, sending the data, and then the database, actually, there probably should be another arrow here, can also then do analysis and send reports back to this individual. So all this is, was created for this. And the algorithms we're going to use are those that we've developed initially to talk about measuring circadian phase through heart rate, predicting circadian phase and circadian rhythms with activity, and also using a bunch of models that have been validated by us and others in previous publications. So what I'll tell you is that the last probably 20 minutes of the talk, I'll probably quickly go through some of the details of those algorithms. Being a data science talk, you might want to know some of those details, but I figured I would keep most of the talk at a pretty high level. Let me emphasize how general this framework is. So in theory, we could have hundreds of thousands, even millions of people sending us their data. And the previous app that we had released in train had, certainly in the hundreds of thousands of people, sending us data. So in that case, we now have one-shot wearable data from individuals spanning long time periods. And we're also going to ask individuals, when did they get COVID and so forth? So then, if enough users used it, we actually could ask all sorts of other questions. For instance, the biggest question right now is, can a Fitbit or a Apple Watch actually detect COVID? Can you see some sort of signatures, changes in heart rate and activity that might correlate or indicate that someone has been infected? And we've actually seen a preprint now come out from a group at Stanford that argues yes. And if this really is true, then this really could revolutionize our fight against COVID. And rather than having to worry about testing, where one test costs more than, a wearable, we could just give everyone wearables and pre-screen people with that. In order to get that, though, we'd have to get tons of people using this app and tons of information, and hopefully that will come a little later. So a little bit about the reports that we generate, and I'll show you them in a little more detail. You'll see a couple pictures of this. One of the standard ways we plot circadian rhythms is with something called an actogram. This is time per day, and it's double plotted. So day one is here, the first 24 hours, and then the second day is the next 24 hours, which is shown up here, that line, and day two also is plotted here. So if you wanted just to look at the left half of this plot, that's okay. People typically like to see both just to look at patterns. What you're looking at here is in black. Every time someone takes a step or has some activity, you can see their rhythms. So this person keeps a fairly regular rhythm of activity, and then at night when they go to sleep, you'll see white. And then here, this red is our measure of circadian phase, and this is a measure of circadian phase we get from heart rate. So again, you could see someone's activity and other things change, it's phase shifting the circadian clock. So this is one of the possible types of reports we could send to people. We also can send them other types of reports about how they've become more or less regular, whether their schedules have become regular, or also if they've shifted earlier. So that being the case, I wanted just to take you through the details and the screens of the app. So the onboarding process, someone downloads the app, it gives them some information. It also asks them to let the app send them notifications. And this is how we anonymously communicate with individuals. So if we want to send them some sort of a report on their circadian rhythms, we could do this through a notification and then tell them anonymously to go retrieve the report, and then they could retrieve the report through the app. We also just give them some general information on data use and privacy, and then we start to collect demographic information. So for instance, we ask individuals, what is your age? And we also could conduct smaller studies to look at specific demographics or specific people and enroll them through something like this. We could ask them to give a particular code. We could code their age, so we could ask them to enter their age and put 101 afterwards to indicate that they're part of, some NIH study or so forth. We also ask them for their gender, and race, just very basic, the minimal demographic questions. And then I think a really important question, which is at the heart of the science we want to get at, are you social distancing? And if you are social distancing, when did you start? And from that information, we could look at the rhythms before and after that date to look for any discrepancies or changes. We also were interested in whether individuals were living in rural, suburban, or urban areas for a couple reasons. One of them is that cities have a lot more artificial light than rural areas. This idea of social rhythms and social interactions, those exist a lot more in cities than in rural areas. And also COVID itself has affected urban areas very differently than it's affected, rural areas. So here's just a quick video of what happens after you've submitted this, after you've answered these questions. So now we know their basic demographics, we know when they began social distancing and the kind of environment that they live. And then they're brought to this screen, which asks them for their data, and then the individual can choose the range of data that they want to send back. And the default is about 2 years. But of course it's all the data up until the current time point. They of course don't have to answer any of these questions. They also don't have to submit any data, but if they do, then we could start running our analysis. We also ask them about various things that could affect their biological clock, or also be related to this COVID crisis. So for instance, we ask them to just check which one of these applies to them. For instance, if they're a shift worker, that's obviously pretty important. If they're a college student, they're pretty important. And there are certain medical diseases, especially bipolar, depression, other things like that, that are known to very much be related to circadian rhythms. So now, in that brief second, what happened was the phone accessed, and she didn't see this step, it brought them to Apple Health where they had to give permission, at which point the phone sent to our servers all their wearable data within that range. If they have a Fitbit, then they also got a prompt, which brought them to log into their Fitbit account and for their Fitbit data to be sent to them. they send it the data, and then the data has to be crunched on our servers, and this is quite a lot of data, steps per minute for, and heart rate every minute for 2 years. So that's crunched with mathematical models I'll tell you about a little later. While they wait for that, there are various screens that could tell them about the app, or also to learn, about how we might use their data in the future, and then pulls up a report. So for instance, here's a particular report for a particular user, and it tells you how your circadian clock has changed by looking at one key marker of the circadian clock, in particular, when the body starts to get ready to go to bed. And as you can see for this individual, the body started to get ready to go to bed to release, let's say, the hormone melatonin a little around 9 p.m. before the crisis, and now all of a sudden they shifted quite a bit earlier. We also give them some other information about whether their patterns are more regular and so forth. And that's basically how the app works. Now, we did get just some preliminary users. We emailed it to a couple lists, including the MIDAS list, thank you very much. And a couple others, a couple people posted on social media. So here's an initial population of data that we got from these individuals. So you can see it's a fairly wide range of ages that we got, at least for this initial cohort. And the demographics for something like this, mobile technology studies, seem pretty good. Again, we're hoping to, increase this several-fold, especially when some papers come out and there's some publicity about that. But again, the individuals who are responding to this, very slightly enriched for women in terms of, races. Most were white, so this initial data set is not fully representative by any means, but it does give us some data to look at. One of the key things is that people can send us back data from anywhere, and we had the app translated into 5 languages. Let me see if I could remember them. French, German, Chinese, Japanese, Spanish, and then I think Russian is about to be released. So a lot of people could use the app for those particular reasons. And most of the individuals who used the app were actually social distancing when they were using it. A small fraction reported that they had completed social distancing. So the question is, did they become more regular or less regular? And most individual schedules actually became more regular during the crisis, perhaps because there were less societal pulls to this. But this looks at just a small sample that we looked at of initial data. This is a larger sample of the 100 or 200 who initially reported. And as you could see, also we're picking up a couple of shift workers, a couple people, with COVID and so forth, enough to really test the methodology, but again, not enough to really start thinking about COVID diagnostics. So this is what some of the data looks like for some individuals. So again, I showed you these actograms. Here's one individual, you could see they're asleep, and here's when they're waking up. And this is the day they started to social distance. So what you should notice is this individual, after the lockdowns went into effect and after they started to social distance, they all of a sudden started to get up significantly earlier and even go to bed a fair bit earlier. And it'll be interesting to watch this individual going forward to see how long this stays. Here's another example of an individual, and this individual has a lot more activity recorded, including some activity at night. There's when they started to social distance, and as you'll see, there's not much of a change. And here's an individual, which I think is probably representative of a lot of college students, which once the COVID crisis hit, they were able to free run and actually change their activity. There's slightly less activity, maybe they're more sedentary and more time on their computer, and also are going to bed and having more activity later on in the day. So again, what we're seeing is not one uniform effect on all individuals, but different types of individuals are being affected differently based on these things. So this is sort of the first part. What we're really thinking about now, and what we would love any input, any ideas that anyone has, is converting this into some sort of an app which Michigan or other students could use to help them as they readjust to campus. No matter what, the fall is going to look very different than other times, other semesters we've had. And students are going to have a wide range of experiences. Some students who will choose remote only experiences and not even move to campus, whereas others who will, and also have to worry about social distancing and so forth. So the idea is to make a version of this app available to students, and then we could give them general information about their circadian rhythms, about when they're going to sleep, and how they could become more regular, and how they could become more productive. And again, this data that we're collecting could also be used to predict a lot of other factors. And it could also be used in concert with other apps that could be released. For instance, we could have a whole suite of apps that could be released for students coming back in the fall to help them adjust. And the first candidate that we were looking to partner with is Sung Choi's Roadmap 2.0 app, which is based on positive psychology. So this is an app I just wanted to show you a little bit, and we've been talking a lot with her. And it's got, it's very different than our app because the apps are sort of very complementary. Our app is very good at collecting a lot of data at one particular time to screen someone and to give them reports and indicate that they might be susceptible to various things. They might not be good for shift work or staying up late, or maybe because of COVID, they've been staying up very late and they should, say, get morning light to help them. But most apps don't work in this one-shot way to collect data. Most apps try to interact with users continuously to get them to do things to, improve quality of life and so forth. And that's exactly what this Roadmap 2.0 app does. So it gives individuals various tools and techniques which could help them with stress and depression and other things that could happen. This was built actually for caregivers and caregivers for individuals who have bone marrow transplant and also those bone marrow transplant patients. But we also think that this could be useful for Michigan students as they're going through what's likely to be a very stressful and difficult semester. So again, they could be screened by our app, which could make suggestions about sleep and other things. And then they could use an app sort of like this to track them continuously, provide them daily feedback. Here you could see the Sung's app also tracks mood, and it does this in a very similar way to Srijan Sen's health intern app. It tells them how much sleep they're having, the steps they're having, and also gives them a lot of just general information about resources that could be helpful for them. And likewise here, we could link to various resources on campus that could be useful to individuals. Sung is continuing her research on this. But again, our hope is that several of us could come together and we could find a little bit of funding and release this, and possibly even offer students wearable devices to use while they use these various apps, and use these apps to help students readjust to campus, adjust their sleep schedules, improve their mood, provide them with more resilience. Let me also say that the platform, the data science platform that we've built, also has a lot of other data. So for instance, data from circadian rhythms of travelers from this Entrain app. It also has built-in, Srijan Sen has shared with us a lot of individuals, who who have, and this is a little old, more than 1,000 individuals who have worn Fitbits. One of the nice things about some of these other studies is that there's genetics. We're very interested in also doing these sorts of analysis with the MyPack data, although I don't think that that MyPack data could just be ported over onto our platform. We'd have to use their platform. So again, I think there's a lot of opportunities to scale this up and to, get a lot more information. What I want to do lastly, in let's say the last 10 or 15 minutes or so, is just now talk a little bit about some of the details of how we analyze circadian rhythms from wearable data. So what I've argued before is that we download all this data from individuals, and each individual is providing, 10 to 100, megabytes worth of their own data. So how do we actually from this, figure out what their circadian rhythms and sleep are, such that we could produce these reports? And maybe in the interest of time, I will just skip to part 2 and talk a little bit about how one would predict circadian phase. So, and again, this is more technical details for the data science individuals. So how the circadian clock works is the following. The most important signal the clock gets is light, and light is processed by the retina, and the retina then sends signals to this core pacemaker, which is located in the suprachiasmatic nucleus of the hypothalamus in the brain, where 24-hour timekeeping exists, and where timekeeping signals are sent out. And so I've developed with others mathematical models that if you know the light exposure that an individual has over time, you could then plug it into a model like this and predict where the circadian clock is. And this is based on a lot of laboratory experiments. For instance, here are some experiments carried out a while ago in Chuck Seisler's group at Harvard, where you have individuals living on different schedules. Here you have 3 days where they're asleep for 8 hours and awake. Then they go through a constant routine protocol, which takes about 40 hours to determine what the state of their circadian clock is, and then give them light exposure over 3 days, and then reassess how that light exposure has changed their circadian clock. And here's a dot is for every individual when they got that light exposure in the lab at that particular time, how much their clock was shifted, whether it was shifted in a positive direction towards European time or a negative direction towards California time. And our models do a pretty good job of predicting this. These are built into other models that predict sleep and circadian phase. And then actually it's used in software packages that people have to predict alertness, cognitive throughput, how good individuals are at particular times or on shift work. We have a lot of different models now of the circadian clock. The most recent model was developed by Kevin Hene and myself, and it uses mathematical tools for analysis of large numbers of biological oscillators, as there are many neurons in this region of the brain, called the OT-ANTENS and ANSATs. Here are some details of that. And again, we get good fits to human experimental data. The problem here, and the problem with using wearable devices, is that most wearable devices either don't record light or record light very inaccurately. So for instance, the Fitbit does not report any light. The Apple Watch has the capability of measuring light, but that information is not available to developers. So here we have this sort of mathematical model where light comes in, and we want to take this wearable data and predict how someone's circadian rhythms have been shifted, and we don't have light. So without light, we looked at whatever else we could, and the obvious candidate here was activity. What these all wearables basically do is measure steps or some sort of activity levels, and we hypothesized that as individuals became more active, their light would go up. So the idea was to use steps as a proxy for light. And so here's a large data set that one could look at, and we plotted the amount of activity for every bin of 10 minutes versus the average light level. And certainly, as you could see, as the activity goes up, the light level increases. We tend to be more active when we're in more light. This is correlation. I'm not necessarily arguing causation here. What you'll see is that once light levels get to close to 1,000 lux, which would be very bright indoor light or dim outdoor light, then this correlation goes away. But the nice thing about the circadian clock is it's particularly sensitive to very low levels of light, and it saturates at high levels of light, which argues that we might be able to use this wearable data to predict circadian phase just from this activity. So we looked at various data sets that were around for where people measured the circadian clock using gold standard clinical assays, as well as people wearing various wearables. And one of them was provided to us by Michigan faculty member Helen Burgess. And again, we looked at 10 individuals, and we looked at where their circadian clock was measured and used this model, used activity, put it in as a proxy for light into the model. And as you could see, we could predict the circadian phase quite well. In fact, we could predict it well within an hour. We tried all sorts of different methods. We also tried to use machine learning to predict light levels from various activity patterns. They didn't help as much, just the linear relationship seemed to work pretty well. Another data set we used was collected by Kathy Goldstein and Olivia Walsh. And again, here, if you look at the measured DOMO and the predicted DOMO, you could see that, again, we could predict circadian phase to within an hour with the Apple Watch. And the final data set that we actually looked at was we looked at shift workers. And this is a data set from Philip Chang at Henry Ford Health System. And what we ended up finding is that predicting circadian phase from shift workers was actually a lot harder. And we actually hypothesized that, I should have some errors here. So here the error is really more like 2 to 3 hours. And I think part of the problem there is that fundamental changes in these shift workers, these are the hardest shift workers, those who work in the permanent night shift, that this is definitely causing major changes in their circadian phase. So that was the first thing I wanted to show you, that again, just some of the details in the technique. So when we're analyzing how an individual's activity patterns and circadian rhythms are shifting because of COVID, we're downloading all this data, we're having it run through our servers, we're using activity first as a proxy for light, putting into the model, seeing how the circadian phase changes, and then generating reports to send to individuals. Let me just show you one more example of how we're analyzing all this wearable data from a data science perspective. And then in about 5 minutes, I'll be happy to take some questions. So the idea here is, before I was telling you about how to predict circadian phase, what about actually measuring circadian phase? And one of the nice things is that many wearables now directly measure heart rate. And it's well known that heart rate actually has a circadian rhythm to it. In particular, in the middle of the day, heart rate naturally tends to be a little higher than at night. And that's separate from the effects of activity. So one would see this behavior if one wasn't active at all and one just didn't sleep and spent 24 hours not really moving. However, this is a very hard signal to extract from this data set because there are so many confounders on heart rate. The biggest confounder is activity. Obviously, we know if we start to run or do other things, heart rate will go up. So we need to take the data and somehow remove this effect of activity. We also know there's a lot of noise, and in particular, the noise of heart rate is correlated. So that's also got to be in our algorithms. We know that if my heart rate is high right now, a couple minutes from now, it could still be very high. And so in particular, we're interested in amplitude, the amplitude of the circadian signal, most importantly, the phase, but also how heart rate affects, how activity affects heart rate, and realized it does it differently for different individuals. Athletes, may have their heart rate go up less for activity than other individuals. So we use Bayesian methods and Bayesian uncertainty quantification also to tell us how good the estimates of the circadian phase are. This is a lot of work that was done by a former postdoc of mine, Clark Bowman, who's now a faculty member at Hamilton College. So here's an example of what the data looks like. So here's an individual with a Fitbit. And as you can see, there's a very nice rhythm here, but also here is activity, and as their activity goes up, also their heart rate goes up. Another major confounder to this, to this analysis is the fact that when we sleep, heart rate changes drastically. In fact, some wearables like the Apple Watch typically don't even measure sleep. So what we decided to do was just discard all data during sleep. And we needed a really good data set to look at. And in particular, we wanted shift workers because they're the hardest people to estimate their circadian phase. So that's where we went and we talked with Srijan Sen, who's been a wonderful collaborator and provided us with a lot of this data, him and his group. What we were able to do was then look at this heart rate data, remove the data during sleep, calculate the effects of activity on heart rate, and then see what the rhythm was left. And for hundreds of individuals, this is the rhythm and heart rate one sees. This is midnight typically. And this is a rhythm, this is experimental data measuring this rhythm in the laboratory and using the laboratory to control for a lot of factors like activity. During this protocol, individuals are not allowed to move around. They're also not allowed to sleep. And as you can see, we seem to be very good about extracting this information. So once again, now if we look at some of these medical interns, we could see both their activity I've talked about, you could see them going on shifts, and also how their circadian phase changes. And in just a minute or two, I'll also mention that we've also published a paper that we could take this activity and also do sleep scoring with the Apple Watch. And we had a very big paper with Olivia Walsh and Kathy Goldstein and Pepper Wang on this in the fall. And we were kind of surprised to learn that Apple now has released their own new sleep scoring with the Apple Watch. Anyway, so that's basically what I wanted to present to you. I wanted to take any questions. I wanted to just show you about how we're collecting data on COVID, how we've built this app and this framework, to collect this large-scale data quickly, anonymously, how we've also developed mathematical techniques to extract features like sleep or circadian phase from it and send reports back. And in particular, if you don't mind, I'm just going to scroll back quite a ways. And also just end with one thought, which is that right now, as we're thinking about an app for students, if any of you have any ideas of how we could release this, to help with the students, I think that would be very good. Some of the previous talks in this series have either focused on research or have focused on data science for good, developing, platforms to help like individuals find food banks or other things. We think that this is something that can actually do both, where perhaps we would focus mainly on taking research and providing it for Michigan students, but also allowing researchers to anonymously look at it. So anyway, with that, that should leave 9 or so minutes for questions. Thank you very much for listening to this, and happy to chat.
Perfect. Thank you so much, Danny. I really appreciate it. Like Danny said, please feel free to ask questions in whatever method is most preferable. Anyone is welcome to raise their hand in the audience. I can unmute you so you can ask your question out loud, save you having to type. Otherwise, we have the Q&A in the chat box here as well.
And I also recognize that this is a talk in the middle of July, so you probably all have a lot of other things to think about. As I said, we're moving today. So.
While we wait for other people to raise hands or ask questions, let me ask you a couple questions though. Okay. One is on research and one is on practical use. Okay. On research, this is really a way to sort of collect massive amount of data on people who usually don't really have any sleep disorder or anything like that, right? So this actually creates an interesting scenario to maybe look at some research questions. So in your mind, what is what are some of the opportunities that this data set will give you? For example, looking at otherwise healthy people who suddenly start having circadian rhythm shifts, or comparing different groups and so forth. Another question is, in practice, I think it's really hard for a lot of people to take circadian rhythm seriously, especially younger people, right? It's, I'm just a night owl, so what? So how do you, how do you, raise awareness in a way for people to understand that this actually is harmful?
Sure, and I think, so let me take the latter question first, because I think it's more in the popular culture. I mean, I think there's a growing awareness of this. Part of it was the 2017 Nobel Prize going to circadian rhythms research. Part of it is recognizing that, for instance, shift workers or nurses or others have much higher incidences of cancer and so forth. Other issues, there's a tremendous amount of links between circadian rhythms and bipolar disorder, things like that. So in that sort of sense, I think there's growing awareness. But I also think that there's a tremendous amount of people who are looking to mobile technology to increase productivity, to inform them how they could do more in one day, because frankly, we don't have enough time in every day, how we could be more alert, how we could have greater performance. And not everyone will care about this, but some people care deeply about it. And some people, like CEOs or others, are particularly interested and particularly willing to devote resources to it. So I think that you're going to see a lot of this mobile technology around circadian rhythms grow, and you're also going to see all sorts of other things start to change. You're going to see lighting around us in buildings being designed for circadian rhythms to help with alertness and performance. You're going to see timing of exams. You're going to see timing of schools shifted so that we're taking tests at peak performance and so forth. And you're also, I'm very happy to say I was part of a collaboration with Essie and Kathy Goldstein to develop an app for athletes. And in those individuals, while you may not care about a 1 or 3% increase in performance, I can assure you they care deeply about those sorts of things, Granted, at the moment during the COVID crisis, there are a lot of other things that are definitely on people's minds. Let me also just highlight the effect of the circadian clock on the immune system. To get a large number of, so let's assume we did our job and we did get a lot of people to download and send us this data. Well, again, realize that we're going to have sent massive amounts of data from individuals. The only thing better would be, if Fitbit were to release all of its data sets to us. But in some sense, the data that we have is even better because we have specific information, like when they started to social distance, or information on whether they're a shift worker and so forth. So I think we definitely can address a lot more of these questions that you're talking about in terms of sleep and circadian, how that's affected by gender, age. Racial disparities is something that I would really love to address with this. There's growing research about racial disparities in sleep, and people may not realize it, but if there are built-in racial disparities in sleep, this is going to have a huge effect in terms of the job market, the workforce, and things like that. And these are questions that we definitely need to address. And the data are showing that they're much more serious than most people realize. And I think it's really important to, just as a first step, to collect that data, to look at changes in sleep and circadian in some of our more disadvantaged communities. So those are some of the big questions. Likewise, again, if we had enough data and we knew when people were diagnosed with COVID, we potentially could even predict when someone has COVID, which is, I'm sure, what a lot of people in the audience would really like us to do. So anyway, that's all one big pitch. This has all been one big commercial to please download our app. It's the Social Rhythms app. And hopefully that answers your questions. Good. So my email is forger@umich.edu. I'm happy to answer any questions by email. Feel free to contact me. And as I say, I'll be start to move back today to the Ann Arbor campus and see a very different sort of a campus. Anyway, I'm very happy to interact. Or if anyone has any ideas, things like that, please let me know. And thank you for inviting me to speak.
Yeah. Thanks for doing this on your moving day, and we'll be happy to see you back at Ann Arbor.
Okay, good. Thanks.
Since we don't see any more questions, let's end the presentation here. And hope you have a good time, smooth time moving back.
Okay, thank you.
All right, thanks, Danny.